Hi, welcome to today's show. We have a very renowned personality with us today. He's obstetric and gynecologist, Dr. Suyash Mandurkar. He is my very senior and we have been planning this for a long time. And finally, it is happening. I'm so excited to have you today, sir.
Thank you for having me.
This podcast will be very helpful for people who are looking a gynecologist as a PG branch. And I think we'll cover a lot about holistic approach of fitness and women's health. And sir has also some personal hobbies and how sir maintains his the personal time and the work life balance. That also we'll talk about. I wanted to start this thing from beginning, like during your childhood. What was it? Were you academically always bright, or how were your interests during your childhood? How was the environment at your home?
During childhood, I had a pretty normal childhood.
Yeah.
Okay. So I was not a very mischievous child, but I was just like any other child.
Yeah.
Not We used to love to enjoy life. We had a great bunch of friends, good family,
Yes, sir.
good society. So it was quite a chill environment where we could play, we could study everything together. As far as studies are concerned, we don't know how to gauge.
Yes.
Because everyone gets kind of decent marks throughout the school, and it depends on how you take it. There were some subjects or some parts of the subject which I used to like. So I had to not put any efforts.
Yes.
Much efforts. But then there were parts and things which I used to not like, and despite putting efforts, I used to not be good at it. So overall schooling has been quite okayish. Some may say I studied. Some may say that I did not study enough. But my childhood was nice.
Yeah.
I cherish all the memories, and I
Yes.
think everyone should try to make the best of their childhood.
Yeah, and that was the only time when kids used to go out and play. Right now, it has become more of indoor things.
Yeah, actually, because the other day I had gone to one of the villages, so I saw a park, and that park had it was not a rainy season, but that park was full of plants, bushes, and there are unattended swings and gasargundi.
Yeah.
Okay, that used to never happen, because children during
Our time used to
used to be there.
Yes.
Okay, they may play there or no, but things are changing. We have to see whether for good or bad.
Yeah. So what was the point when you decided that I'm going to be doctor, or this is something I'm going to chase and I have to become? Or was it like that I have to become a doctor, or you had some other options also? What was the turning point sort of?
Well, there was not a turning point, or there was, how would I put it? Okay, so I come from a family of doctors. So my parents parents are doctors. So what happens is when you grow with a certain family, the exposure to those things is more.
Yes.
And because of which there is natural inclination or bias
Towards that field.
that may have made me choose this field. Having said that, I had pretty good interest in physics and math. So I had, if I had not to become a doctor, I had other options.
So you took both maths and this biology both. Did you have any options or to leave it or something like that? Whether you had to take only biology or
No, I had option to leave, but then I was okay with.
Okay.
So because I got through to medicine, so.
And was it like you're from family and all that, ki my son will become doctor? Was it like that, or there was a freedom to you that you can become?
See, during that time, the things were because either doctor, engineer. Okay, so my family, both the parents are doctors. My uncles and all are couple of engineers. So they might have been happy that I'm a doctor, but I think if I had to choose engineering, then they would not have been upset.
Yeah. So you were always like you could have achieved either, but more inclined towards MBBS. I think your time there was a CET, Goa CET, or Goa CET.
Goa CET.
Did you get it in the first attempt, or sir, they were like?
No, I got it in the first attempt, and I don't know. I admire the people who keep on giving efforts.
Yes, sir.
Because it's good to have a clear vision. But in my case, I might have not given a second attempt and got a
other engineering or other.
Yeah, but it depends on which college and in which stream. And I would not like to go into details. I don't want to don't have issue with engineering.
Yeah. Did you have any coaching sort of thing during your this, or you?
2 years before, when we were in 10th, that is the time when that CET saga started,
Yeah.
and everyone was quite skeptical. So every parent like thinks for their child, and they are also slightly in a, so because I stay in Ponda, and at that time there were not known coaching classes, but there was Aryan at Margao in Penjin, because Margao was closer. So I was enrolled over there. So for 2 years I went to Aryan's, and during our time a lot of coaching centers started in Ponda.
Yeah.
Okay, but it was a fun journey. Got to learn a lot more of physics and maths, which I might have not learned through my higher secondary. But it was, looking back, 11th and 12th were quite a journey.
Yes. As you said, physics and all, because when I gave my exam, I had attended very few questions of physics. I just answered chemistry and biology, the main. So how was your thing? Did you get time to answer physics also? Or?
Yeah, so I vaguely remember. So there was some exams during, because there used to be multiple exams during that time. There were some exams in which you had to answer all physics, chemistry, maths together.
Yeah.
So those were the best, because some of the organic and inorganic chemistry questions are direct. You don't spend time on that, which you can use for physics and maths.
Yes, sir.
But then when it comes only to CET, I think like physics and maths were marginal.
Yeah.
Whereas biology and chemistry, you get plenty of time.
Yeah. Let's talk about your MBBS journey, sir. So how would you describe your MBBS journey? Was it like any particular incident you remember, or any sort of ragging sort of thing you went through? Any particular thing you want to describe during, as like in general? How was your?
So my MBBS journey was very good. I had a great bunch of friends, and the thing is, the switch from 12th to MBBS was slightly different.
Yeah, it is.
Okay.
Yeah.
Because 11th and 12th, we were a bunch of friends who were interested in physics, maths. Biology, I used to study on my own.
Yeah.
Physics and maths, they were the subjects where we used to sit in a group and discuss. So it was more of concept based. And when you join medicine, the entire way you study the thing changes.
Yeah, I agree.
So I don't say that medicine is not concept based. Many people take it in completely wrong context. They think it's just about mugging up and memorizing. It has concepts, but it has like serious weightage on memorization. This nomenclature.
Yes, sir.
So initially it took. And also the concepts become clear when you are in 3rd and 4th MBBS.
Yes.
That's like final MBBS.
Yes.
So initially it takes time to adjust. And first MBBS, obviously, vivas after vivas after vivas. You don't get time to breathe. So with so much difficulty, I had learned brachial plexus, and I was quite happy at the end of 2 weeks, because I could like remember. And then I realized that once this is over, we have to go to lumbar plexus and all this thing.
Yeah.
But then usually tend to underestimate our brain's ability. So we have that plasticity. Within no time, you can get things done which you never thought that you could do.
Yes, sir.
So after that, it was quite a smooth sailing. As far as ragging is concerned, when we joined, there was a big people told us that there will be ragging and all those things. And I don't know whether it used to happen or no. But sometimes we used to be called by senior for just a routine introduction. But we used to get scared. We used to get scared, and we used to think that is ragging, but it was not. It was absolutely, as far as I'm concerned, there was no ragging for me. But I can't say, because some other people might have
faced it. Yes, sir.
But when you look back, you think that those are the simplest of the things, and those are very important, because that's the time you start to get into uncomfortable situations and learn to speak to other people in such situations.
You take it as a challenge and you overcome.
You may not realize it while you're over there, but if you have crossed that thing, then obviously it does help you.
Yes. Otherwise, everything being too smooth is also not good. Sometimes you have to, get that life's challenges at early time of life, so you become strong. To get the challenges and overcome that in your coming life. And any particular incident you remember about UG that you want to Nothing like best.
There are too many incidences, like fun incidences.
What about your sports things, sir? Like, how was your time after you, it used to be at finished after 4:35, and what was your life after that? Were you as a hostelite or you used to go home?
In first MBBS, I used to go home.
Hmm.
And then after that, I joined hostel, and then we used to be in the hostel. The days were, every day was different. So can't really say. There are too many incidences. As a medical student, we don't really acknowledge the fact that we have gone through so many things. Like the first day we enter anatomy dissection hall, and you see those dead bodies without the heads. So that was one thing. But luckily, I never had any like issues. But all this kind of things, there are small things which made the MBBS journey memorable. But then obviously the tour and all those things.
Yes, sir. Tour
And also we get to see a lot of different personalities. When you join a postgraduate field, that time you can learn about different, if anyone has interest, you can learn about different personalities, because MBBS, people think all the doctors are the same.
Yeah.
But I think in MBBS you get to see
A lot of different people.
lot of different.
And initially, sir, when we join, there are a huge group of friends, and as we go, the friend circle becomes small. You tend to understand the reality of.
I used to tell any junior batch who asked, go for college tour the end of first year, early second year. That's the time you'll have the biggest group. You will have the least number of biases, and you will have a fun trip. Because there have been batches who have gone later, but you always see that the groups become smaller.
Yes.
And the internship is the time to make friends during MBBS, and you lose friends during internship.
Yeah. So anything you want to say to the people who have just joined MBBS, who are finding it a bit tough, because we know it's a huge jump from concepts of 12th standard, right? We compare to the first year anatomy and all that, it's a huge jump, and there's no similarity between any of the topics. So if somebody is finding that tough and who wants to, who is like, in a way you can say that kind of regrets in taking MBBS, what do you want to say to that person? So as a word of encouragement.
See, each and every, like there are some people who say that this is my goal. But then many of them, even them, and most of the others, you start picking up things as you go.
Yes.
So life is a journey, and it's not like a destiny. You may have something in mind, but a lot of things are going to come your way. So you have to take each and everything positively. Just that you need to have an open mind. Because there are things, bad things happening to you, good things happening to you. So take everything positively, and you need to generate interest. Now the issue with current situation, I think, is because there's too much focus on neetpg. Your right from first MBBS, people have started
Going to Marrow and all that.
Yeah. So if that generates interest, then it's good. If that's not generating interest, then people may find it difficult to get into the rhythm.
Yeah.
Because see, it's a lot of memorizing.
It is.
It is a lot of memorizing. But then you realize if things are easier, things are interesting, then you're going to pick it up. And those who are struggling right now, you don't need to worry that everyone gets through this phase. So it will be quite simpler.
Yeah, I think we, as we grow, if we stick to the plan, if you just stay there, face the challenge, I think we tend to adjust over time.
Yeah, and if you're right now struggling, just when you start with your clinical postings and when you start applying things, it becomes really easy, and then you tend to correlate everything, and it becomes much easier to. People don't know it's much easier to write a final MBBS answer as compared to a first MBBS.
Definitely.
That's because you are getting better at concepts. You are able to correlate things. You just need to give it time.
And I think during first year we find it difficult to procure the stuff, like where to study from what. And as we go to second year, third year, we know where to study what from. So that becomes a bit easier, I feel.
Yeah, that's true. According to me, in any field, teachers need to be there just to create interest.
Definitely.
Okay, I don't mind a teacher walking in, spend 5 minutes talk 3 lines and go out of.
Hmm.
I'll just give you a simple example. No one likes history. Okay. I used to kind of like it. But then we used to never study till the exams are close by. So during our 10th standard, we had World War lessons. And I was not very interested in reading lots and lots. So the moment I got that book, first thing I did was read that World War lesson because I wanted to know.
No, yeah, it was interesting.
After that, I never read that lesson, but I could still memorize the answer.
Yes, sir.
So that's just because I had innate interest in learning that. So it happens in each and every field. So if you don't have the interest, you need a teacher who will just get that interest. If you get that interest, you're going to learn it.
It can.
No one needs to come and spoon feed you.
Yes, sir. And sometimes it can backfire also if the teaching part is not that good. I think sometimes students lose that interest towards that subject.
Yes, because the thing is, everyone joins medical field to become a doctor, clinician.
Yeah.
Okay. Not many are academically inclined. So they may not have the liking to have that interest. And also there are some, it depends on teachers also. Like if you are a teacher and you see that in your class 10 people are not listening to you, if you are getting demoralized, then you will not go back and put in so much effort.
Yes.
But if you are a kind of a person, you will see that 2 people are finding it interesting. So make it more. So it's both teachers and the students.
They become a cycle. Like teachers, if not teaching, students lose their interest. And if a teacher is trying to, teach better, trying his best, but the students some of them are not paying attention, the teacher gets discouraged. So I think that cycle.
Yeah, it's a cycle. If we can make classes a bit more interesting.
So yeah, I know.
So hopefully our new generations.
Definitely, I think
maybe a laugh in between can help.
Yeah.
Because we had teachers throughout our
MBBS.
Not only MBBS, throughout our life, who don't like smile on anyone's face. Why are you smiling?
Yeah.
That smile is a good thing.
Yeah.
Why everyone should be frowning?
Want it to be you to be thoda scared, and that creates a lot of pressure.
Yeah.
I think students need to be a little bit free to express themselves if they have a doubt and all that. So I think that's a very good advice, sir. What do you think about this MBBS seats, being increased? Like they are during your time, I think they were like 80 or
100.
Okay, 100. Now it has become 180. So what do you think about that?
The thing is, in India, the doctor to patient ratio is not ideal. We need more doctors.
Yeah.
So the aim is to increase the number of seats of the doctors. Now the thing is, the aim. This is my viewpoint. The aim is to get more doctors to cater to the needs of people. But the entire ecosystem and infrastructure is such that most of them want to be specialists. And earlier, if you don't get the seat, 1 or 2 years, and people used to start their GP practice or join some government setups and all. Now people are keeping on giving. So till you're giving those attempts, you're not serving the purpose.
Yes.
Okay, so that's one point. And secondly, once you become a MBBS or MD or MS, most people, because of lack of infrastructure, they tend to go and settle in a bigger city.
Yeah.
So in a bigger city, there are many doctors. There are villages across the country where there are not enough doctors.
So disparity is there.
Yeah. So we need to increase the seats, but then we also need to keep in mind what's the situation, because right now in Goa there are a lot of doctors, but the PG seats are not increasing. So all these MBBS doctors, they are keeping on trying for PG, then they are going out. So if this increased number of seats, if it is helping public, then we need to see it. I have not done enough research over here.
I think there is some kind of disparity between the number of UG seats and number of PG seats.
Yeah.
That's what. Yeah. So now, sir, we are coming to one of the most important part. I think our audience definitely wants to know that this talk that right now there is NEET counseling is going on. It has started. You chose OBG, that is obstetric and gynecology. So how did you come to that choice? Because we know that choosing the branch is one of the most difficult part, because that changes your life after that. That is, the branch you take is for life. It's not for that 3 years. So how did you come across that branch?
I needed something surgical.
Hmm.
Okay, so general surgery was on the cards and gynecology was on the cards.
Hmm.
But then later on, the thought process, then I chose gynecology over general surgery because it is considered an end branch.
Yes.
Okay, and this was my thought process. And as a general surgeon, though general surgery is a very good field, in current scenario, you need to do a super specialization.
Definitely. Yeah.
Whereas as a gynecology field, it is considered to be an end branch. Whatever you do after that is considered to be a bonus.
Yes.
Whereas at this stage in general surgery, I feel like a surgeon will be able to answer this thing better. But I think most people will prefer to go for a
Super specialty.
yeah, and I had to give 2 years for my all India preparation. That was quite mentally taxing. Okay, the study part is one aspect.
Yeah.
All the self doubt, and then you see your friends going ahead, and yours stuck over there. So, and it also depends on what kind of environment you are surrounded with. Okay, so and also it depends on your maturity level.
Yeah.
And you keep learning new things. So that was one reason why I chose obstetrics and gynecology. And later I realized that there are two big aspects of obstetrics. One, you can only do a medical aspect, and then there is a big surgical aspect.
Oh.
Okay.
I didn't know this. This is like you can go in a medical aspect side and surgical. It's like that.
But people usually prefer to keep both on
Okay.
together because it's slightly
Better this. Yeah.
for your
scope and all that.
the practice.
Yeah.
Okay. Also, another plus point I would say is you always think that you want to see more smiles rather than people crying. So it's a good field because most of your patients will go home smiling, happy.
Yeah. You always wanted to go in surgical field.
Yeah.
Surgery and OBG, but you are more inclined towards OBG.
At that stage, I was because I didn't know after 3 more years, would I be willing to sacrifice 2 more years doing studying for a super specialization?
Yeah. So because of the end branch.
Yeah. So that was a big point, and I had liking for both the subjects.
Okay. During my internship time, I have seen a delivery. That time I was shaken to my core, and I thought this is not for me. I think many of us drop OBG at that point of time, seeing the delivery and all. The PG aspirants who want to take OBG, or the MBBS students who they want to take OBG, how do they overcome this fear?
I would not say fear because I don't think many people walk into a labor room for the first time with the mindset that they'll be scared.
Yeah.
But then the turn of events cause some people to be frightened. Luckily for me, I never had any of these issues.
Okay.
So I don't know how you can improve it. But the thing is, even if you faint for the first time, seeing all the blood and all this thing, you do get used to it.
Yeah.
So if you like the field, just because you had a scary moment in when you entered the labor room first time, that should not keep you back. You will overcome those.
Yeah. So when we see it during MBBS times, it is something different. And when we are actually working in that field, it becomes a bit different thing. You actually see it as a patient-doctor thing.
See, we teach a lot of things, like how to manage seizures, how to manage PPH, that's bleeding and all. It's all nice. Everything is on the book. And you know it.
Yeah.
But when it happens in reality, are you able to keep your cool?
Definitely.
That makes a big difference.
Yeah.
In managing the
cases.
Yeah. So as you keep on working in the same field with the right environment, you do tend to get better at handling things. So I think that should not be the issue. And like how they say, the best way to overcome the fear is face it.
Face it, definitely. Yeah, that's true. All over India, you say that gynecology is known to be one of the most hectic as well as toxic branch. So I just want you to give us an idea that how hectic it is, and whether this branch being toxic, how true is that? So I want our people, our students or doctors who are aspiring to take OBG as a branch, they have to get that idea. They can't just choose a branch just because they're getting it. They have to have an idea that once you enter it, that is going to be your life, and those 3 years are very important. But they also should have an idea that in reality how hectic it is and how toxic it can get.
First and foremost, the branch is hectic because you can get emergencies at any point of time.
Yes, sir.
Okay? No point of time, you are relaxed. Okay? Second part is, I like to say that when you get any patient, depending on different departments and different fields, I like to say that there is a particular part which you are responsible for. Like, for example, if a patient comes to you, you may be, your management might be 75% responsible for patient health, and 25% will be all the like nature or God, or
it's always there. Yeah.
Especially on the obstetric part of it, where we talk about delivery and all these things. It's more like your part becomes less and the rest of the part becomes more. So I'm not saying that your responsibility is less. I'm just saying that despite giving your best, there is a lot more that can go wrong even when you have done everything right, because there is a drastic change in physiology. Because during pregnancy, patients have a lot of blood volume that increases. So their organs have to function more, and post-delivery everything goes out. So there is a kind of a shock to their heart, and so how well their body is going to cope up. You can just do a risk assessment depending on various conditions, but it's never in your hand. You can do the best job and things can go wrong.
No.
So if things go wrong, you need to be vigilant enough to pick it up and manage it without getting stressed. You need to know where you stand, you need to know what you need, and you need to pick up the signs.
Yes.
Many people say that OBG is a toxic trait. Now, toxicity definition changes according to everyone. Like, if you ask a junior resident will say that senior resident is toxic. Senior resident will say consultant is toxic. Consultant will say HOD is toxic.
Yeah.
If you ask an intern will say the junior resident is.
Yes.
The toxicity part depends on person to person. But there's one more thing. If there is a chance of complications, what you, and at any time, how your mindset changes is you try to do everything so that you minimize the risk of those complications. So that you can have at least 50% of your day where you can relax. There is a chance, or you will have a gynecologist more towards like being over on the cautious side, will try to get everything ruled out rather than just leaving it for the time. And there are more things that can go wrong. So sometimes, because you are slightly overcautious, people who are not in your department, like for example interns, at that time they don't realize. For example, if a patient comes to you, I'll just give a simple example.
Yes.
A patient has come to you at around 8 o'clock at night. Okay, you have sent the blood. Now you expect this patient to deliver by morning. Okay, let's say her HB is 7. So HB 7 is low. You are expecting at least 500 ml to 1 liter of blood loss. So at HB 7, it's highly possible that this blood loss will not be tolerated by this patient.
Yes.
Okay. So in antenatal period, you take enough efforts to make sure that the HB is not sent.
Yes.
But then everything is not in your hands. You just see the patient once. What patient does at home, it's not in your control. But now let's say this patient has come to you. You have, if you get this report by 10 o'clock or 11 o'clock, patient is going to deliver roughly by morning. So now you have enough time to get blood ready, transfuse one, and like keep more standby, so that during PPH, if you see any hemodynamic fluctuation, blood is ready. If you are sitting just idly, then when the patient will have that hemodynamic instability, you don't know why it's happening, because you don't have the blood report. Your blood is not ready, and it's a mess. This is a very simple example. So to avoid those things, there is a kind of urgency to get those reports. And sometimes it's not very pleasant for interns. And I do agree that there are some people who need to learn to get things done in a bit. See, there are certain emergencies where you can't be
calm enough.
But then there are certain times where, so this is where the environment, what is created around you makes a difference.
Mhm.
Now, let's say if there are some things which I can inform half an hour later, and it is not going to cause a big problem.
Yeah.
But you are getting fired for that. Now, how that person who gets fired takes it depends.
Yeah.
So, if that person absorbs it and says that this firing is just a part of it, it's not going to affect the patient, I'll be cool. Then what you say, the toxic thing doesn't occur.
Yeah.
See, if I fire you, I'm not toxic.
Yeah.
But if I fire you, you start firing her, she starts firing someone else, then she starts firing someone else. This is the circle which happens.
Yeah.
So then the entire environment becomes...
Take your personal thing on Instagram.
So the best thing, and as far as toxicity is concerned, I think all the departments have toxic elements.
Yes. Clean.
Okay. So as a MBBS person, you never realize. Internship, you half realize depending on what the junior most resident is doing.
Yeah.
When you are a part of department, you may join the simplest of the simplest department. You will realize that this department is
Definitely
toxic. Now that's the thing. If you need to assess when someone fires you, are you actually doing something wrong which can affect life of certain person?
Yeah. Very well said.
Then you take the stress, or you just learn, take that firing as a positive and go ahead. If they are firing for just their ego trip, then you should be smart enough to realize that it doesn't affect you and go ahead with it.
Yeah.
Now, I am not justifying any of these things, but each and everyone in their own ways is stressed because of something or the else. When intern says that junior resident is troubling him, intern never sees through junior resident's eyes. Same thing happens from junior resident to senior resident to consultant. Each and every person has. But when everything comes down to the life of the patient, the urgency, the stress, the tension slightly increases, which makes this feel a bit taxing. But it depends on how you take it. If you have a bunch of friends, good people around you, it doesn't really matter.
Okay, so now you said all this about toxic. I want people to understand the workload. Like when you joined during your first year residentship, how was the workload? Like whether you had some time for your personal life, whether you had time to have a bath or food, like in that terms of thing.
So as far as our PG in Goa is concerned, it was quite okay. Okay, as in the duties used to be very hectic. And we all know there are 36 hours duties. We have spent enough time.
Yeah.
All the residents all throughout the country have spent enough time talking about this, that the duty hours are not feasible. It's not good for residents. It's not good for the patient.
Yeah, it's not humanly.
Just I'll ask one question. Now, if you take any of your relatives to us for a surgery,
Okay.
if there is a senior doctor who has not slept for 58 hours and he's looking very sloshed,
Yeah.
versus there is a junior doctor, capable junior doctor, who is fresh, whom would you want to let us?
See a fresh one.
Exactly.
Yeah.
But this is the core culture which our country still needs to accept, and like we need to work towards it. Now, coming back to the first question, so we used to have those 36 hours duties. Once in 3 weeks, we used to have 60 hours duties. Some duties we used to be very bad, no sleep. Some double duties went without any sleep.
Okay.
There used to be some duties which were quite okay, because we were like 4 or 5 people. We could take turns and get a 1 hour, 1.5 hour nap.
Yeah. So that's the only thing you got, 1.5 hours.
It depends on
So what is the maximum time you slept in a day during your residency, if you remember?
4 hours, 5 hours. Sometimes even 6 hours. But that 6 hours is not like a peaceful 6 hours. You're just you just keep getting up. And you become so tense after working in such a field that even if your duty is going cool, you will keep waking up in 45 minutes, check your phone that if I missed a call.
So that you are always vigilant, even though you are sleeping.
Yeah, you are. But in our, we had 3 units. So we used to get like one duty, the second day you go and sleep, and third day you used to get some time for your social life. There are certain colleges with slightly better duty schedules and certain with even worse. But in Goa, at least, we don't have so much workload as in some of the other states like Maharashtra, Bihar, UP, where you will have like 30, 40, 50 deliveries happening in a day.
Yeah.
Here it's slightly lesser, but then the quality of care, the expectation from people also is very different.
That's true.
So everything has a plus point and
But
minus.
it is quite one of the most hectic branch as it is.
As far as specialties are concerned, on a long term, it is one of the hectic branch.
Okay.
Because in other fields, you may have emergencies, but they may not be very often. Here, it will be very often.
Yeah.
But now there are other super specialties like neurosurgery and cardiothoracic surgery where it can also become quite hectic. But then it is indeed one of the hectic branches.
Yeah. Okay. So that is the one point you have to, know coming from sir himself, that it is one of the most hectic in long term also. So you have to keep that in mind when you're choosing OBG. Sometimes you take it out of interest, but then that interest can be short lasting when you're actually working in that field and face the reality, like how hectic it is.
It depends. If you like the field, you are going to love working over it.
Yeah.
But then I feel the time slowly and automatically changes the way you think and way you see it, so that, and you, like we Indians have a jugadu mindset. You tend to like find ways in which you will make time for yourself.
Yes, sir.
And make things easier for you.
So one of the $1 million question when it comes to OBG, as a male specialist, is there a stigma regarding, male doctors being gynecologists when it comes to patients, or even, senior doctors? Do you think there is any stigma when you choose gynecology as a field as a male doctor?
So in Goa, there's not much stigma, at least as of yet. In some of the North Indian states, there is a stigma. The thing is, earlier, as our society is progressing, I feel the stigma is becoming slightly more. That's because earlier people have a mindset that males are doctors, good doctors.
Yeah.
They used to go to males irrespective of anything. And most of the deliveries used to be done by dais at home. Okay. Now, because there is more awareness, lot of people are now preferring to go to a female gynecologist. But then it doesn't reduce your scope as such. In Goa, we don't find it. But in some of the other states and communities, you will find these things. And if you are planning to go to Gulf with just obstetrics degree, it may become quite tough for you to practice in some of the...
As a male doctor.
As a male. Only as far as obstetrics is concerned. As when you move away from obstetrics, when you go into gynecological aspect and all, it's slightly, the stigma is slightly less. There are two branches, like sub-branches, obstetrics and gynecology. And each, the way the patients think are different. So as far as obstetrics is concerned, there may be a tendency for some people to go towards female gynecologists, but it's not seen so much in Goa because there are so many established male gynecologists who have booming practice.
It's true, sir.
Okay. As far as gynecology is concerned, earlier there used to be stigma of females talking about gynec problems to like menstrual problems towards
Male doctor.
Yeah, but then that stigma is not there. So as far as gynecology aspect is there, I don't think there is so much of stigma. But it depends from which community and most importantly, you need to be open because it's ultimately patient's choice. You can't.
If you're not comfortable, you can't do anything.
Is patient, and that also we need to like be bit more gentle about it.
Yeah.
If you are a male gynaec and she says that I'm not very comfortable, can you suggest me a female gynaec? Then if you can, you suggest. If you can't, then respectfully like.
Yeah. Sir, as you said, this OBG is an end branch. So after doing that, there's definitely a lot of scope. So we can always practice and you don't need to do further studies. But you also have done gynecological laparoscopy, if I'm pronouncing it right. So fellowship.
Yeah.
So, what was your thing about doing fellowship?
I needed, like, there is slight inclination towards doing laparoscopy surgeries.
Mhm.
Okay. And I just don't want to restrict myself towards the obstetric side of it. It's not a necessity per se right now, because obstetrics can give you enough income or cases.
Yeah.
For me, I wanted more of a laparoscopy, to learn more of laparoscopy science, because it's much better than doing a major surgery. It's better for patients also. So if I can help patients in that aspect, then it is indeed impressive.
Okay. Are there any other fellowships that you were considering?
So far, at least, I have not considered any other fellowships, but we also need to realize that one thing it's said about OBG, that people will keep on getting pregnant, people will keep producing children. This is a evergreen. But also you need to know that all over the world, the fertility rates are dropping. Okay, either it's dropping because of some health condition, or it's dropping because of patient or people's choices.
Yes, sir.
So it's not like earlier, patient used to come to you 3 deliveries, then there are 5 sister-in-laws and sisters and sister-in-law in line, so they'll all come to you. Obviously, you need to be good, compassionate, then only they'll come to you.
Yeah.
Okay, so they all people will have 3 children, 15 children. You are going to deliver from one family. That's not happening anymore. Okay, there are hardly, at that first generation, there is either 1 or 2.
Now that
And then, yeah, so then one maybe,
yeah.
and there's no other sister and sister-in-law who will come to you. So the number of deliveries is decreasing, and the infertility is coming up in a big way. So infertility is another aspect that you can go and do super specialization. This gynecological oncology which is coming, and also fetal medicine is also coming up. Nowadays, it's there are more fellowships in minimally invasive procedures and cosmetic gynecology. So it's becoming quite interesting.
What is this called? Cosmetic gynecology, sir?
As patients become old, they have those lax vagina and all those things. Now people are using lasers and
So mostly little lifestyle and all that.
not exactly. Multiple procedures and all they will be doing through lasers. No, initially everything used to be scalpel and blade. Now all the procedures will be done through lasers. See, as our generations have gone ahead, the expectations from life are also changing. Like people want better sexual life even later. So because like multiple normal deliveries can cause them to have a very lax vagina, and also those are some things. Then even prolapse and all those kind of things. A lot of new things are coming up.
Okay, so that is the cosmetic gynecology.
Yeah.
Moving on, sir, you have mentioned that one of your interests are women's health and preventive care. So what do you exactly mean by that?
As you keep going ahead in life, you learn new things. When I finished my MD, because initially we also think, as far as MBBS is concerned, it's delivery and all the things related to cesareans, then hysterectomy, then we are taught about fibroid, menorrhagia and everything. Then when you come out, now as I practice, I see almost every other girl suffering from PCOS. They have irregular menses. And most of the things seen today have something related to lifestyle. Okay. So that is the kind of awareness that I want to bring about.
Okay.
Because what happens is there are medicines and everything, but till you solve your basic problems, nothing is going to change. Where you see these people running to one doctor or take medicines from them, then after that they go back to their old problems. Then they keep on changing doctor shopping, and ultimately they don't get the result, because the main aspect of the thing is they don't address the root cause. So for that, we need to have more voices that will talk about these things. And people often think that fitness and all like only meant for people who are into bodybuilding, aesthetics, and or some athletes. We have a very polarizing thought process in everything.
Yeah.
Because see, if you want to learn about or follow something related to fitness, you'll follow a hardcore bodybuilder or a hardcore athlete who will be training 6 times, 7 times a day, once in the morning, once at night, and then you you obviously can't match
Not
that
practical,
person.
yeah.
And that's why you say this is not for me, and you go completely on the opposite side.
Yeah, because it's too much. Yeah,
Yeah. So, but you need to realize that to remain healthy and fit, you need not do all these things.
definitely.
You need to find a balance depending on your goals. And most of the problems which we are facing today are related to lifestyle and can be easily managed if they can get their lifestyle on track. So, because there is lack of awareness, there is increasing laziness among people, expectation for a quick fix by not putting in efforts. This is pushing us more towards unhealthy, which is not being addressed adequately.
So, what are these changing trends of the lifestyle, all the diseases that are seen nowadays?
There are two aspects of it. One is all these changes earlier used to not be there. Nowadays, they are quite common and they are happening at a very young age. Now, the other aspect you need to think about is earlier people used to get married by 18, 19, have 2 kids by 25, and all these changes and problems, even if they occurred, they used to not be bothered. Nowadays, people are more bothered about all these things. People are trying to not get married till 30, 31 just to build a career. And you get all these changes occurring in your mid-20s. And then they are scared that their fertility may be hampered. So that's why they are also coming in more and more number towards the clinics. There was one video where when doctor says never ever medical book says that you need to go to the gym.
Yeah, I see it.
So it is true. Medical books don't tell you to go to gym, but medical books don't tell you to be a couch potato.
Yeah, that's true.
Okay, so just addressing one aspect of it and not addressing the other aspect of it is not correct. So the other aspect is earlier what we used to do in a day. If you see earlier, people used to go walk to the nearby well. I'm just talking about females right now.
Yeah.
Walk to the well, get water. Okay. And I'm not saying that they should be doing all this. I'm just saying the amount of work, the physical activity that is reduced.
Yeah.
Okay. So that used to be one thing. Then people used to go to fields, work over there.
There's a lot of manual work.
Grocery shopping, you walk to the grocery store, then you have all the household work, and then if they were working, they used to go walking to the workplace, work over there, come back. Used to be, and at the end of the day, they used to be tired, eat, sleep.
Yeah.
Good sleep. And because they were working all throughout the day, they used to be hungry, they used to be sleepy. So they used to eat, they used to sleep well, and get up the next day. So I'm not saying that you need to follow this lifestyle. Okay. We are in a better situation today. We should be using the better things that we have versus how the trend has changed. So you get up in the morning now. Most of the girls are working right now. So you get up in the morning. Just now, people have just started going for healthy lifestyle. But just most of the people, you get up, you don't have time. So you take cereal, mix it with milk, Kellogg's, some more sugar just to make it more tasty. Then you either drive a car or you take a cab, you go to the office, you sit all throughout the day, you sit in the office, lunch and everything you sit in the office, hardly any steps. You come back home, anything related to grocery, you get it on Blinkit. Anything related to food, you get it on Swiggy, Zomato, everything
very accessible.
So in this, physical activity has gone.
Yes.
Because of which now it's becoming very important that you put dedicated time to get your steps, to get the physical activity done. That is why going to gyms and working out is becoming mandatory.
Yes.
No medical book had expected, and no one had expected us to, the technology to go so far that everything will be done at home.
So I think the advices given by non-doctors towards health are increasing nowadays compared to doctors actually giving the advice. In online, I'm saying, sir.
Yes, but then the thing is, more doctors need to speak the right kind of thing, because an expectation from a doctor is not the same as you would expect something from a... I don't blame doctors, because if 10 doctors say you have to go and work out and one says you don't have to go and work out, all the crowd will say that doctor is saying that we don't have to work out.
Yeah.
So it's just validating your thoughts.
Yes.
As a kid, a kid wants to go out and play. So he'll come and he'll ask his mother, she'll say, don't go. Then he'll go to ask his father, he'll say, don't go. That's 5 different people, all will say, don't go. Then the 6th one who says go, he'll say he has told to go. And
Yeah.
so basically, people do what they want to do. Just take the word for validating their thoughts.
That's what, according to you, is ideal age to have a kid, or maybe the latest also. Both the spectrums of age.
Mainly it depends on person to person because of their thoughts and because of their goals in life. But in 20s is usually a good time physically, okay, to have a kid. Before 20, it's not very safe.
Okay.
And as you age, if you go more than 35 and all, the chances of chromosomal abnormalities and all increase. Okay. Nowadays, what is happening is the chances of people, because of the unhealthy lifestyle, them getting diabetes and hypertension, which will complicate the pregnancy, also increases as their age increases. Going beyond 30, 31 becomes slightly risky because of those kind of things. But then also you need to understand the second aspect, that the maturity, now people are becoming mature at a later age because they don't have to face the hardships during their...
So you are saying so physically or mentally, the maturity?
This is the physical aspect. I would suggest people to get conceive in 20s to mid 20s.
Okay, mid 20s to before
to 30.
Okay.
21 to 30 is fine.
Okay.
But then if you are from a good family in a well settled area and all these things, you don't see lot of hardships during your childhood, because of which you don't get that maturity as compared to what earlier generations used to get. You may be late 20s and 30s and you may still not be mentally mature enough to have a kid.
Yeah.
So that is another aspect that people also need to think about.
Yes, yeah.
Because it's not being spoken much on the gynec side, but I think psychologists and psychiatrists will be talking more about this. One more aspect. Now, film stars are getting married at 40 and getting children in the mid 40s. Oh, like they may... But I don't want to get into all these things. But the thing is, they are maintaining their healthy lifestyle.
Yeah.
Okay? I'm not justifying anyone trying to conceive beyond 40, but I'm just saying because they have well planned everything, even in 40, they are in good physical condition. Their pregnancies usually come with lower risk and they obviously have access to best of the healthcare facilities.
Yeah.
Okay? But so if a normal person can maintain a good lifestyle, the safety to conceive later in life, like just beyond 30, 32, 33 will increase.
Yeah.
Those are the things that need to be considered.
Okay. So between in your mid 20s to 30s, that would be ideal time to conceive.
20s is actually physically ideal.
Okay.
Okay. Mentally, they need to think about when they want.
Okay. Okay. And so
also one more thing is many want 2 children. They plan their first child in like mid 32, 33 and it becomes very difficult for them to conceive again. If you are planning to have 2 or maybe even 3 kids, like plan it like around 25 at least. If you are okay with 1 child, it's fine, but ultimately it's a personal choice.
Okay, okay. And now we see increasing trend towards, I think every second or third lady getting PCOS. So how do they, deal with that?
PCOS mostly is related to lifestyle. People with poor lifestyle, poor eating habits, lack of physical activity, they tend to become fatter with increased fat tissue, that is adipose tissue, which causes all the hormonal imbalances. So till they don't address that aspect, they will remain in that cycle of gaining weight and worsening PCOS, gaining weight, worsening PCOS. Most of the people get scared because what will happen to their pregnancy.
Yeah.
But there are other aspects which are not given enough. We are at a higher chances of getting type 2 diabetes, hypertension, cardiovascular events, cancer of the uterus in the long run. All these kind of things usually get a backseat. So people really need, and it's a lifestyle related problems in most of the cases. It's not like every PCOS is, but if you correct the lifestyle, most of these things get corrected.
Yeah.
So we are not just giving them a better chance to conceive, but you're also giving them a better quality of life by decreasing the risk or delaying the onset of all the.
So you are saying just maintaining your health and fitness level, you can improve this PCOS PCOS disease.
Absolutely.
Yeah. Okay. So that you have.
But having said that, now again going back to my previous point, people have a very polarizing thing.
Yeah.
So if someone says that lifestyle changes will help you, then what they'll do is just focus on lifestyle and never visit a doctor.
Definitely.
Okay, and whatever things are happening internally may not, because everything is not reflected externally. So you need to find balance. You need to know that you need to seek medical advice, but at the same time, you yourself need to work on yourself and just not rely on some medicines. People are very,
as you said, polarized towards.
yeah, and there's one more thing. They hop on medicines very easily and hop off medicines very easily.
Chocolates.
Yeah, they eat medicines like chocolates. Okay, something happens, they start the medicine, within 3 days they stop the medicines. Like, you need to give your lifestyle a chance. It's not happening, then you start with medicines. Give it a chance and find a balance.
They want instant relief, sir.
They want instant relief, and once they get the relief, they forget about it. This is if you talk to any pediatrician, this is a classic toddler behavior. They want a toy. They will cry for the toy. Once you give the toy, they forget about them.
Yeah. And sometimes what happens is the practitioner who wants them to, give that a chance to lifestyle and combine that holistic approach, instead of like one doctor does that, other doctor just gives the medicine and they get
they'll
take the other.
Yeah, but the relief is a symptomatic relief.
Yeah.
It's not treating your.
Yeah. So people need to understand that getting instant relief is not always good. Sometimes
it's not good at all.
Yeah.
It's just a supportive treatment. Like if you bang your head somewhere and now you are having, you're bleeding from your head.
Yeah.
And just popping painkillers to get rid of that pain is not correct. You need to
you're not addressing the problem with the root cause. So now, sir, you are also a certified health, wellness and fitness coach. So how did that happen? Why do you think that was important? Because you could have easily been like, I have done already OBGY, I have done fellowship, so I don't need to do other things. You already have your life settled when it comes to career. So why was this needed?
Again, here there are two main reasons. The first reason has to do with my own self, because I had many issues putting my lifestyle together by studying a lot and learning a lot about all this health and fitness related things helped me personally in a big way. Then when I see my patients, they are also going through the similar kind of things and putting their lifestyle also on track. I'm sure I will be able to help them. So to know more and to help more people, I decided to put in work and get this.
So you're saying you are obviously interested in the holistic approach of fitness and medical thing combined. So I think that helped you more, or that is the thing that motivated you to get this.
So whenever you go through something, you do a certain change in your life and it helps you, and then you see similar thing happening to someone else, then you realize that maybe you can do the similar thing and teach similar thing to the other person, so that the other person also gets benefit out of it.
That's true, sir. That's true. Now you also have an Instagram page, sir, that is Health Fit by Dr. Suyash. And I think we all have seen you posting very regularly. So why online? Why Instagram? And how do you get time? I think OBG as such is a very hectic. Even after completing the work life is very. How do you manage? Even we, as I just finished my MD. I also don't get that much time. So how do you get time to post? That consistently.
You need to find that.
Simple.
See, the main thing is I started this page basically because there is a lot of things which people can do on their own, which can solve 80% of their problems. They just need to be taught and educated properly. There's a lot of noise, misinformation, which is going on, and I want to address all these things. And going on Instagram currently helps me to get to more people in one shot. I talk about PCOS, maybe 1,000 to 2,000 people can watch the video, one video, and I'll be able to educate those people. But when in a clinic, it's 1-to-1.
Hmm.
Okay, so that's also other aspect of it. But then Instagram helps me to reach to the masses. Secondly, lot of misinformation has been spread since our ancestral times. Okay, they used to not be affected by that, but now we do get affected by that. And also, they didn't have access to all this kind of things, like good things what we have access to. Like there are gyms in each and every nook and corner, and they are pretty good gyms in Goa.
Yeah, true.
Okay, so when they have access, why not go and use it? And it hardly costs anything. People cry over 2,000 rupees for 30 days. You go to a restaurant for a dinner and you spend 1,000 rupees per day.
We see a lot of casino culture also here.
Yeah, exactly. Yeah. So that is the main aim, to find the. Also regarding the time, it takes 2 minutes to shoot,
Yeah, that's true.
10 minutes to edit,
Mm.
15 minutes to compile a.
But it is not always true, sir. Sometimes your mood is not there and all that. So
Yeah.
as you said, you need to find time. You need to be, liking that thing also. And what are your thoughts? As you said, that the reach increases, the online way of spreading awareness. So what do you think doctors should be going into making Instagram content or online content?
Main thing is content creation boomed as an industry in COVID. Many people started going into content creation, YouTube and everything. Then you ask a younger generation person, like a kid, they say that I want to be a YouTuber. People who are not into content creation think that it's very easy. It's not. It's not. You need to add value to other people's lives.
True.
For which you need to know their problems and you need to put in enough work so that you can put it out. As you said, if every doctor should, more doctors should do content creation, it's a personal choice because it is not easy. It's quite simple. You can make it very simple. But then in the previous question, you asked, how do you find time? If you can do it, send the right information across, then you should. If you can help people at a large scale. But it's not easy. People from outside, people think, hey, video karta.
Yeah.
It's not.
Especially when you're starting out, it's very difficult. Like people think it's more of a cringe sort of, and especially doctors why do they need to go into this content when they already, I think that part is more.
Also earlier, what used to happen, if there is a doctor in a village, you send a car with that loudspeaker, the doctor is going to address about some disease today.
Yeah.
1,000 people would come out.
That's true.
You send a van today. You put a stage, not a single person is going to come out.
Yeah,
but at least you can reach to those people through your content.
So the ease of getting or spreading awareness, I think it can be boosted by the use of Instagram or the online platform.
Correct.
But it has to be used in a right way. Like the audience has to gain something from it. It has to spread some kind of positivity. So that would be the main thing. You see, the question I had, I see a lot of people now who are creating content, the medical people, maybe they are students, maybe they are interns. I think there are a lot of people who show patients in their content or clinical setup and all that. You think it is advisable to show that in the in the content, in the videos, the patients, they're treating the patient?
I think we are moving towards society where we care more about human rights. So if you're going to put your patient out, then I think you need to inform the patient that he or she will be used in the video. And if they give the consent, then they can show the. And as far as workplace is concerned, it depends on each and every hospital's policy. If your hospital doesn't allow you to shoot, then you should not be shooting. And if your hospital is okay with it, then
because sir, I have seen a video where a person in emergency setup is showing a clip doing a CPR.
Exactly.
Yeah. So
very good point.
Yeah. I think it is not ethical when it comes to that. How you can show a person doing, if you are doing CPR, that means that is one of the most critical situation. And if you have a camera, if you have someone who's shooting, what does that show?
It also depends on in what context the video was made. If it was made for
educational
content
was not
on a specimen, then it's a different thing.
it was related to something like doctors feeling like God, doctors saving you by doing this, CPR, they're saving you from death. It was something like, it was not educational, like they were not showing you how to do CPR. It was not related to that. I felt it was very offensive. I commented there also ki you should be very considerate when it comes to, putting out such content, such a critical situation. And then a lot of other people started jumping on my comments saying, why he's at least putting content on that. That is also difficult. Why you have to, put him down. But I think certain things should be kept indoors when it comes to the ethical aspect.
The thing is, without patient's consent, anything going out is not okay.
It's not.
Okay? Because I may not be very comfortable showing myself on the camera, and if I'm not, then my content without my knowledge should not go out. Secondly, about ethical aspect, as doctors, the way our mindset is very different as compared to a non-doctor.
Yeah.
Okay? And it's not about like us being good or us being bad. It's just because the situations we have been exposed to. If you are working in a neurology department, or even in gynec, if you are working in a pre-eclampsia patients, if you see a patient convulsing, a doctor will remain calm. If a third person sees it, they'll feel that doctor is indifferent.
Yeah, that's true.
It's not. He's calm because he knows what is to be done. He panics, then the situation is going to get worse. The primary provider, if he panics, everyone panics. Okay?
Yeah.
As a doctor, you need... So, that's one aspect. Secondly, people are not used to seeing someone convulse. And I don't know if everyone is ready to see people convulse. It may be one of the reasons, like some people will say, I did not join medicine because I didn't want to see people convulse. And now you're putting the feed out for them to see patients convulsing. Is also a bit odd. And the third thing is, certain things like CPR, it's not pretty to watch.
It's not.
It's not pretty to watch. General public, they don't realize the CPR is done to like save a life of a patient or just bring back the dead.
Yeah. Resuscitate.
Yeah. Can look very violent for a general audience. But having said that, I feel we can put out content in which we are trying to educate people to how to give a CPR, because right now we are seeing so many kinds of like people just collapsing in a gym setup and all the people, if they don't know the right technique, no amount of like pressing their chest is going to revive the patient. So that's one thing. And I had also seen a video where a person wide awake, I think he had some syncope or something but he was wide awake. He was given CPR by people, like no one was a doctor over there. They panicked and they started giving CPR to a person who was wide awake.
Okay.
Like, so we can
use it as awareness.
We can use it as awareness, and like actually we should promote like CPR, but it should go in a right way.
Right way. Well said. And so there was one more incident. I don't know. I think you must have definitely heard about it. This is related to OBGY only, where one of the influencer doctor or someone had accused private hospitals of choosing cesareans for benefit purpose. So I don't know if you heard about it. And it had become a very huge thing. And one of the famous gynecologists from a private thing only addressed the situation. I know, very aware about this, sir.
Not exactly. But then I have heard many people say that...
accusing.
Yeah, accusing. But then I can't speak for each and every doctor, but the reasons for people going for cesareans are plenty. I don't know if each and everything is like 100% indicated, but I always feel that no other doctor working in other setup can talk for other person.
That's true.
Like, for example, if you don't have a setup to resuscitate a neonate or anything, you will definitely be more cautious in baby having even mildest form of distress. So either you deliver her normally or take her for cesarean or refer her, okay, as compared to a tertiary care center where you have every facility. So the patient's condition and even the setup of the hospital also makes a...
so you cannot generalize the state.
I feel each and every place is different. And depending on the resources that you have, the way you look at the thing, because ultimately the aim should be to have a healthy mother and healthy baby. If you're following books and everything and ultimately you're not serving the purpose of having healthy baby and healthy mother, then somewhere you may be missing out on the true essence of this.
Yeah.
Having said that, I feel you should always give the right information to the patients. If your setup is not meant for high risk pregnancies, you can tell them that our setup is not meant for high risk pregnancies. We may have to be slightly more cautious so that you and your baby can be in a better condition, for which we may have to do a cesarean, more likely a cesarean in this situation. And as far as like people usually accuse saying that doctors are doing cesarean because they can charge more. But I feel normal delivery, the effort and the time it takes to conduct a normal delivery safely is much more as compared to, it's not riskier, but the patient will be there for almost like 12 hours or more than that. You need continuous monitoring of that patient. That labor room will be used. Whereas the OT, your patient is going to go and come out in 1 hour. Is it for money? I don't know. Like you might as well charge more for normal delivery for putting in so much. But so I can't generalize this thing. It also depends on the area where you are, what are the resources are. Like for example, if you are in a remote village in one of the rural parts of India, you can be justified in like carrying out a delivery because there are no hospitals around. But then you cannot be justified in going to someone's house and waiting for normal delivery for even an hour if your hospital is just nearby. Available. Yeah. So it depends on various things. People just see from their point of view and generalize it.
They are very keen on accusing things.
It's limited
Bias towards.
no, it's a limited sight.
Yeah.
They don't have the entire picture.
And
And people are very quick to put
and
their
also
opinion.
doctors, no sir, I have seen this. They're very eager on accusations and all that. That doctors is bad. That part comes very fast when it comes to other professions, that I feel.
Let's say if you go to a restaurant, okay, you like the food, you're going to come out, not do anything about it, okay? Just be happy, talk to people about it. But if you had a bad experience, first thing you're going to go, write an email to the manager, go on Google, give them 1 star. So the thing is, any bad thing gets highlighted.
That's true.
Whereas 100 good things which that restaurant like had served those people, no one has gone and put the good review.
Yeah.
So similar thing happens to a patient or in any aspect when if someone comes on the screen and he's like this one is bad, that one is bad. But if you go in the locality and ask other people when these things are pulled, they will tell you, no, he was very good, he has helped us in many situations. But then they don't come out on camera and tell that. So if everyone
Defense.
if every opinion matters, then even good opinion should come out like without any manipulation. No one's mind is changed. Like good opinion should also come out.
That's very well, sir. Very well put, actually. And thinking about this, I actually wanted to ask you, suppose a male gynecologist is practicing. For his own safety, what are the precautions he should take when he is, having a patient, obviously female patient only, but like that time, for his own safety, to protect him from legal things and all this, what are the precautions he should be taking?
So first thing, it's not only for male gynecologists. Any male, whenever he's examining a female, should have a female attendant by the side. Okay. Now, according to me, it will serve 2 purposes. One, it will protect him. Okay. And secondly, more importantly, it should comfort the other person.
Yeah.
Because the thing is, whenever a new patient walks in, she doesn't know you.
Yeah. True.
Okay.
Yeah.
She will be uncomfortable. Also, you need to explain to your patient what is being done, even if it is minor of the minor things. So what happens is our medical colleges are so busy. The OPDs are so busy. You don't have enough time to spend with the patient explaining them what is going to be done. So because of which this habit needs to be changed when you come out. Because now you need to explain even the simplest of the simplest, because you may be a male or a female. You just put yourself in a situation, you go to a doctor and doctor says, "Tum bhitar wach bed ar need." You will be
Uncomfortable.
uncomfortable. But if the doctor has told you, no, we'll put you inside, we'll just check on the abdomen if there is anything. If required, we may have to check certain other private areas and all, which will serve this purpose. If you're comfortable, we are going to do it. If you're not comfortable, I'm not going to do it. But the diagnosis may be missed and your treatment might not be complete. If you say all these things, mostly patients are okay with it. And you need a female attendant so that patient is also comfortable. But there could be problems coming up even after you follow all these things. So you need to be ready for all this.
Okay.
And the simplest thing, always take consent. Like right now, at least you ask the patient. Now in a few years, the medical legal thing will become so strong that now you will have to start taking like written consents. But if a patient says no, she's uncomfortable,
Don't do it.
don't do it. Okay? Mention it on the paper. Patient is uncomfortable. That's why this examination not done. And the findings are not enough to come to a diagnosis. The diagnosis may be missed. The privacy of anyone is the most important thing. You need to understand even your patients who come to you will be, they don't know you. So they will be uncomfortable.
Yeah. That's true, sir. Now, we were just talking about restaurants, sir. So, we'll just talk about the other aspect of your life, which is also very important to you, the traveling part. How much do you like traveling and like what are the best places you have been so far?
Traveling has been my part of my life since childhood. But the way I like traveling had changed. When I was a kid, we used to go for short trips and all whenever possible. Not very fancy, but then we used to be like more of touristy kind of a thing. Like, go visit the important places, get some souvenirs or all. But as the years have passed, I have started enjoying traveling more from an experience point of view. And I like places which other people may not like because the way we experience the thing is very, very different as compared to most of the other people. So there's no rush. There's no hurry. Just walk and experience the big place. Also, you tend to learn a lot of things when you travel and your horizon widens. You realize that there are different kinds of people. Now, we may be talking something in Goa. We may consider it offensive, but maybe across the border in Maharashtra, the similar speech is not offensive. So I'll not go into examples and all, but when you go to different parts, you realize how different mindsets are, how different cultures are. Even food plays a big role in cultures. As far as my favorite places are concerned, Mussoorie, I'd been last year. And I remember in 6th standard, we had a 6 or 7, 8 standard in Hindi. We had a lesson Mussoorie ki God mein. Since that time, I always wanted to visit a place. Thing with me is whenever I read something, I visualize an image. So I don't remember the lesson now, but I had this image and I wanted that image, like to relive the image. So many years we couldn't go. This year I went and it is one of the most nicest places. Landor is one of the most beautiful, tranquil places I've been. If possible, I can go there every year.
Yeah.
But it may not be the most fancy. You may not get very flashy things over there. Second is Hampi. I feel if you are into
ancient,
it's like exploring, you must go to Hampi. You get to learn a lot about the olden civilizations. They have manuscripts carved on the
stories.
The thing is, a lot of budget trips go to Hampi. But I've heard that in 2 days they cover 4 places. We, on the other hand, in 3 days we covered just one place. Just keep walking. Sit wherever you can, just
Serendipity.
Yeah, like just take time to absorb this the place. So that's how we travel, and we just. But because of my profession, I can't
Stay for too long.
Yeah, otherwise I would have been all trying to cover all the places in the world.
So, sir posts travel content about new restaurants, new places on his main page, I think, named Dr. Suyash Mandurkar.
No, it was Sweet Success.
Okay, Sweet Success.
Yeah,
Yeah,
because
Sweet Success.
Suyash,
Yeah.
Suyash, so Sweet Success.
Okay, I'll give that handle in description. And sir also posts about fitness and all, is very consistent regarding that. So he has a page that is Health Fit by Dr. Suyash. That also I will mention in the description. Okay, you definitely can go and check it out. Coming from outside to our favorite place, Goa. So what are your favorite places to visit in Goa?
All the Goans, our Goa is very dear to us.
Very dear.
Okay, entire Goan coast. Okay, there's a reason why people come to Goan beaches. Because despite of all the madness that's happening in Goa right now, Goa had some of the best beaches even today. You go to most of the other known beaches and it's very dirty. Goa still has very quite nice and beautiful beaches. We need more of peaceful beach life like what we had in like 20 years back. It would have been even better. The entire coastline, but not the, I don't like the noisy part of
Hidden gems.
like the calmer aspect, what nature has to offer to us. And like most of the in rains, the eastern part of Goa throughout the ghats and on the foothills of ghats, all the Goan things which tourists don't go to. Those are the one of the best places. And I'm not saying they are best because tourists don't go there. But like I think they don't have enough knowledge about it. Or maybe they come to Goa for a reason. You can expect them to go and enjoy this thing. They will be like, अरे ये तो हमारे घर में है, हमारे स्टेट में है, इधर गोवा में जाके क्यों हम पहाड़ चढ़े? So the raw Goa, the village, the forest, and the real Goa, not the fleshy Goa,
which is painted by outsiders at beach and clubs and all that. Real Goa. Sir, what are the etiquettes you want or you are suggesting to people who visit Goa? So there has to be some etiquette that you can't behave however you want. You have to maintain the sanctity of the place. So your advice regarding that?
So whenever anyone travels to any place, you first need to understand that there are locals living over there. You cannot cause inconvenience to the locals, may it be anywhere. Okay. At the same time, locals also need to realize that as tourists, they want to come and enjoy. But because there have been like clashes when tourists have caused inconvenience to locals, now the locals have become so defensive that they are becoming quite aggressive against any tourist. Which is, I don't think there should be some amount of balance, because when you go to another state by spending money, you have some expectations. You can't just like shoo people off just because they are outsiders. But I think we need to enforce better laws. Like you can't be sitting on the main road, because see, when someone sees a picture of Fontaines, they never know that it's a real street. I think they think that it's a street which is made for the photography.
Yeah.
So they go and royally sit on the road when it's actually
People live there. Yeah.
And the worst thing is there are two or three schools over there. So in PCOS, it's just a mess for people who are going to the school and coming from school. So, and also they come with that mindset. Because I have been to other states, and when I tell them I'm from Goa, the responses which we get are not very pleasant.
Yeah, it's not.
So I think we as Goans also have a role to play in putting out. So because some of my content in which I had shown some ritual which has been done, and the people are like, ये सब गोवा में होता है. So like people, they don't know. Okay, and as Goans, we need to put out more things which make Goa what it is. Certainly there is another image to it which has been blamed the outsider. You can't just blame tourists for that. There is some role which has been played. Like if you have a shop and you are selling everything for 10 rupees and there's one thing you are selling for 5 rupees, people will come for that 5 rupees.
Yeah.
Then you can't say that 5 rupees is not my... So, but then there should be a balance. Like tourists also have to realize that this place is for, you can't just keep on roaming the main road outside the old secretariat.
Yeah.
Try to drive there from 7 to 9. It's a mess.
Mm-hmm.
There's all tourists all over the place. It's a main road.
Yeah.
So why those things are not being managed properly?
Yeah.
So everyone has a role to play. Everyone is falling short. Even we are falling short. So I hope everything like smooth and
I think even the littering is one of the part which is most disturbing. Like people just litter on places.
And one more thing, I this may be not a part of this. One very poor thing, like very annoying thing that Indians do. I don't think Goans do, but like rest of the Indians come to Goa and they do it, and Goa gets a bad name. Is asking random foreigners for selfies. How would you like if you have gone to another country and the locals over there are taking your photos on their phones and keeping it with them?
So privacy breach.
And normal people are not used to having their photos on someone else's phone.
Yeah.
And what are you getting by doing all this?
I don't know. So I actually don't know.
And we have seen it all throughout the country. Wherever we have gone, we have seen the Indians asking people for photos, random people for photos, because of which foreigners don't have a good
image.
And then because the number of foreigners in Goa were more, this thing is happening more in Goa.
Yeah, that's true. That's true. Because I think we have covered most of the topics when it comes to your own personal life and OBG as a branch, then fitness, women's health, everything. So I think we would like you to just in your own words, some piece of advice to young MBBS doctors who want to pursue OBG as a branch.
Number one, if you have the genuine interest in a field, you need to see that interest and go for it. Also need to not just think about this 3 years, but for rest of your life. Okay. Secondly, may come times in your life when your perspective and things about life will change, and you should be open to that. Not being very rigid. And lastly, I have one piece of advice for everyone. To live, we need to earn. To earn, we need to work. But then we work so much that we work and earn so much, but we don't have time to live. So there we need to find balance, but it depends. Like some people are very ambitious, they can do with their thing, but some people are just in that loop.
Yeah.
Okay, they are there because they were pushed into it, and now they are just going with the flow. But it's not allowing them to like really enjoy life and at the same time do something which is fun. So mainly whenever you choose a branch, whenever you choose anything, you need to consider what it is going to give you. Okay, if freedom means a lot to you, you see how you can get more freedom. Okay, if money means a lot to you, then you see how you can make more money. More money as in you need to give value to the people and make more. Okay, not find loopholes and make. So that's about it. As far as PG branches are concerned, I feel the one thing is during your internship, just put in more efforts. What happens, most interns are to themselves. Okay, they keep talking, and even I was the same. Like I've learned this now, and if given a chance, I would be a bit different. Spend more time with residents, talking to them, just see their life, each and every department, and you will realize which life you would like to live. You need to gain skills and all these things, and you need to like talk to patients and like understand what they want. Okay, it's not always that patients want treatment from you. There are cases like 3rd stage cancer and 4th stage cancer where you keep on poking patients they don't want all those things. Okay, so as a doctor, okay, patient want tender caring love, and you are like, I'm busy, I can't give so much time. that's fine, don't give, but you can facilitate someone else. There were some interns in our batch, means when we were residing, our other residents used to say, "Te kai kaam karna, to kai kaam karta." But they were some of the most compassionate people. They used to not do other work. So whenever I thought that this patient needs some tender caring love, I used to give them a call. They used to do the best job.
Communication, yeah.
Best job. At the end, patient used to be happy, they used to be happy, because not everyone is meant for everything. You need to understand what the other person wants and give them all these things. Patients mostly are happy.
Yeah. Okay, I think we have got a very good advice from Dr. Suyash, and I feel we are very thankful, we are honored to have you, sir. And in future also we would like to have more of these sessions and hope to see you here.
Yeah, thank you so much for having me over here, and it was nice that I could put my points forward. Hopefully this helps many people.
Yeah, I think it will be definitely an enlightening session.
Yeah. Thank you.
Thank you, sir. Thanks.